Stop. If you are over 60 and taking Lisinopril, Amlodipine, or Metoprolol, your medicine cabinet is a minefield for your eyes. You are protecting your heart, but you might be quietly causing permanent glaucoma or macular degeneration. Your doctor has 10 minutes for you. I have the full truth. Most seniors assume their vision loss is just aging. It's not. It's the pills. Here are the 5 groups of blood pressure medications stealing your sight and exactly how to stop the damage. And listen carefully. This is not a call to quit your medication. It is a call to connect the dots before your eye symptoms are dismissed as normal aging. The timing of a new pill, a higher dose, or a new vision change can be the clue your doctor needs. Group 1, the Thiazide Diuretics, the water pill trap. The most common first-line treatment for hypertension in the US is the water pill. You know them as hydrochlorothiazide, HCTZ, or chlorthalidone. These drugs are designed to flush excess fluid and sodium from your blood vessels. But here's what the pharmaceutical ads don't emphasize. Your eyes are fluid-filled organs. That means your lens, tear film, cornea, and eye pressure can all react when your body's fluid balance changes. A small shift in hydration can feel like a big shift in vision. When you take a strong diuretic, it doesn't just target your ankles, it creates an osmotic shift inside your eye's lens. This is why many seniors find their expensive prescription glasses suddenly feel off. But the real danger is acute angle closure glaucoma. Clinical data shows that these meds can cause the ciliary body in the eye to swell, pushing the iris forward and physically blocking the eye's drainage system. This causes a massive sudden spike in eye pressure. Beyond the emergency, there is chronic dry eye. By flushing fluid, these pills dehydrate your tear film. Without that protection, your cornea develops microscars every time you blink. If your eyes feel gritty like sand in the morning, your heart med is the thief. Do not just keep buying stronger eye drops without asking why the dryness started. Track when the symptom began and whether it followed a medication change. You must ask your doctor about your hydration levels and ocular pressure if you are on a daily diuretic. Group 2, beta blockers, the optic nerve starvers. Next are the beta blockers, metoprolol, low pressor, atenolol, or carvedilol. These are gold standard heart protectors, but they have a dark side for your optic nerve. Your optic nerve is like a fiber optic cable. It requires a constant, high-pressure delivery of oxygenated blood to function. The optic nerve does not scream when it is starving. It fails quietly, often through slow peripheral vision loss that seniors may not notice until the damage is advanced. Beta blockers work by slowing your heart rate. While this saves your heart, it can cause nocturnal hypotension, a dangerous drop in blood pressure while you sleep. When your systemic pressure crashes at 3 a.m., the blood literally cannot reach your optic nerve. This leads to normal tension glaucoma. This is the most frustrating condition I see. Patients come in with perfect eye pressure, yet they are losing their peripheral vision. They are going blind because their heart med is suffocating the nerve while they sleep. If you are on a high-dose beta blocker, you need to monitor your nighttime dip and discuss the timing of your dose with your cardiologist. Protecting your heart should not mean suffocating your sight. Do not change the dose yourself. Bring the question to your cardiologist and eye doctor together, because the goal is not choosing heart or eyes, it is protecting both. Group 3, calcium channel blockers, the macular menace. Now, let's talk about the heavy hitters. Calcium channel blockers, CCBs, like amlodipine, Norvasc, or nifedipine. These are incredibly effective at relaxing blood vessel walls, but they carry a terrifying link to age-related macular degeneration, AMD. The macula is the part of your eye that lets you read, drive, recognize faces, and keep your independence. When it is damaged, the world does not simply get blurry, it gets distorted. Recent large-scale clinical studies suggest that long-term use of CCBs may increase the risk of wet AMD. The retina has a waste management system that clears out debris. CCBs interfere with how calcium ions move in and out of cells, potentially disrupting this cleaning process. This allows drusen, yellow metabolic waste, to build up faster under your retina. If you have a family history of macular degeneration, being on amlodipine requires extreme vigilance. Are you seeing puffy eyelids in the morning? That fluid retention is often a signal that the drug is affecting your ocular tissue. We must balance your arterial relaxation with retinal protection. I recommend an Amsler grid test every single morning for anyone on long-term CCB therapy. Cover one eye at a time. If straight lines start bending, missing, or warping, that is not a symptom to ignore for months. Group 4, ACE inhibitors, the inflammation trigger. Group 4 includes the pril drugs, specifically lisinopril, Zestril. Everyone knows about the Lisinopril Cough, but few talk about ocular angioedema. Swelling around the eyes can be easy to dismiss as allergies, poor sleep, or salt. But if it appears after a medication change, it belongs in the conversation. These meds affect the renin-angiotensin system, which can trigger low-grade chronic inflammation in the uvea, the middle layer of your eye. This isn't a sharp pain. It's a dull, heavy ache behind the eyes and an increase in floaters. These floaters are often inflammatory debris inside your eye. Furthermore, ACE inhibitors can change how microvessels in your retina constrict. For my diabetic seniors, this can lead to tiny microbleeds or retinal hemorrhages. The drug protecting your kidneys might be causing microvascular damage in your eyes. If you see cobwebs or dark spots, don't wait. Get a dilated retinal exam immediately. New floaters, flashes, dark curtains, or sudden vision loss should never be treated like a routine aging complaint. Group 5, alpha blockers, the surgical nightmare. Finally, we must talk about alpha blockers like terazosin Hytrin or doxazosin. Many senior men take these for both blood pressure and prostate health. This is the one many patients forget to mention because they think prostate medication has nothing to do with eye surgery. If you ever need cataract surgery, and most seniors do, these drugs are a nightmare. They cause intraoperative Floppy Iris Syndrome, IFIS. During surgery, your iris becomes limp and billows like a sail, getting sucked into the surgical tools. This can lead to permanent pupil deformity or a detached retina. The most frightening part? The floppy effect can last for years after you stop taking the drug. You must tell your eye surgeon if you have ever taken an alpha blocker. Do not assume it is already in the chart. Say it out loud before surgery, even if you stopped the drug years ago. They need special tools to keep your eye stable. I'm not telling you to stop your meds. That's a stroke risk. Stopping suddenly can be more dangerous than the side effect you're trying to avoid. The goal is not fear. The goal is a smarter conversation with the doctor who knows your heart, kidneys, and eyes. I'm telling you to be an informed patient. Here is your plan. The medication audit. Did your vision change within 30 days of a new pill? Timing. Ask your doctor about moving your beta blocker to the morning to avoid the nighttime dip. Nutritional shielding. Fight back with 20 milligrams of lutein and zeaxanthin daily to protect your retina from chemical stress. Your vision is your independence. Don't let a hidden side effect take it away. Comment vision below. Share this with one friend on blood pressure meds. You might save their sight. I'm Dr. Mason. Stay healthy and stay sharp. Subscribe for the truths your 10-minute clinic visit won't tell you.